exception. They don't volatilize, and they don't spread person to person. Botulism, the most toxic compound known to man. 15,000 times more toxic than the nerve agent VX. Okay, it's just amazing stuff. Okay, it's the same stuff that you inject to get rid of your wrinkles. Botulinum toxin. Okay, if you remember how nerve agent works by blocking acetylcholinesterase, so you end up with too much acetylcholine. It's overstimulation of the nerves. Botulism works the direct opposite. Botulism prevents the release of acetylcholine. So with nerve agent, you have all these secretions. With botulism, you're dry. Okay. With nerve agent, you have overstimulation of your GI tract, your bowel, your bladder. Okay. Botulism blocks that. With nerve agent, muscle fasciculations and twitching. Botulism, weak muscles, paralyzed muscles. Just the opposite. It tends to start with the nerves and muscles of the face and work its way down. Okay? So it's a descending paralysis. You get blurred vision, you get double vision. Your eyelids, they get droopy because you can't raise them up. You have trouble swallowing, trouble speaking. Okay? And then your muscles become weak. Eventually they paralyze the muscles of respiration. If it's not recognized, you die a respiratory death because you can't breathe. Okay? There's a kid with botulism. Okay? You can get it a number of ways: inhaled, foodborne. That's the most common way. I personally have taken care of a patient with botulism. It's a very impressive disease. Okay? So, cranial nerves, check them. Weakness, paralysis, etc. How do we make the diagnosis? We take blood from the patient, we inject a poor unsuspecting mouse, and see if it develops botulism. Okay? That's how we make the diagnosis. That takes a couple days. Treatment is supportive for the most part, so be sure they don't develop respiratory arrest, respiratory failure. Intubate them, ventilate them. Okay? There is an antitoxin. It actually works pretty good. It prevents the progression of the disease, but not the disease itself. So, if I got botulism, my eyes are weak, I'm having trouble swallowing, okay? I'm weak. It'll prevent me from going on to complete paralysis. It does not reverse the findings that are already here, okay? The only way these findings get reversed is when our nerves regenerate the ability to release acetylcholine again. In average, that takes 2 to 4 months. Okay, so you're going to be weak for a while. Okay, the patient I took care of, he and his mother made ribs and potato salad. Okay. Chowed down, had some left over. In their infinite wisdom, they left it out on the counter. Okay, 2 days later, he came home, saw the food out on the counter, chowed down on what was left. 24 hours later, he presented complaining of trouble swallowing, sore throat, didn't feel good, mouth was dry. Came to Denver Health, complaining of his throat. Resident took a look at him, said, "Sore throat, you don't need to be here. Go." The guy couldn't get off the bed. So the resident came to me and said, "I got a guy here who I think is malingering. He wants to be admitted to the hospital for his sore throat." Went and looked at the guy. He couldn't get off the bed. Okay. He was physically incapable of getting off the bed. He had walked into the hospital 4 hours earlier. In 4 hours, he went from walking and talking to so weak he could not sit up on the bed. Okay. Eventually we figured out what was going on with him. I called the CDC to get the antitoxin, which they were going to ship to us overnight. We admitted him to the hospital at 11 at night. At midnight, he basically had progressed so much that he had to be intubated and placed on the ventilator. He was on the ventilator for 4 months until he was able to get off that ventilator. Okay, so impressive disease. Terrorists can weaponize this, inhaled botulism. Okay, very easy to do. Ricin. You should be familiar with ricin because it's been in the news. You may remember the most famous case of death by ricin being a Bulgarian diplomat in London who the Russians decided they wanted to assassinate, KGB wanted to kill. So they put a little bit of ricin on the tip of a sharpened umbrella, poked him in the back of the leg with the tip of the umbrella, embedded the ricin in his leg, and 4 days later he was quite dead. Okay. Ricin is a cellular toxin. It just kills any cells it comes in contact with. You can inject it, you can ingest it, you can inhale it. 200 times more potent than VX. Okay. Bad stuff. It's the product of castor bean oil manufacturing. So we make tons of it, most of it gets destroyed. Okay. Inhale the stuff, you get fever, chest tightness, cough, shortness of breath, necrosis of your lungs, airway necrosis, and death. Ingest it, nausea, vomiting, diarrhea, like everything else, bleeding in your GI tract, necrosis of the liver, spleen, and kidneys, and death. Inject the stuff, you get necrosis of muscles, lymph nodes, multi-organ failure, necrosis of those organs, and death. Okay, so the common theme here being death. Okay. Bad news about ricin is we have no treatment for ricin. There's no antitoxin, there's no vaccine, there's no nothing. CARE is totally supportive, and to date, you get a decent ricin exposure, you're toast. So, bad news. The last toxin I'll mention is, next to the last toxin I'll mention is SEB, Staphylococcal enterotoxin B. Okay. This is a product of Staph aureus, which again, bacteria everywhere in the environment. Sudden onset of fever and chills, familiar theme. Nausea, vomiting, diarrhea if you ingest it. Okay. No pulmonary symptoms. Okay. You're not going to die from this. You're just going to wish you were going to die from this. From a medical perspective, all it's going to do is tie up a lot of people taking care of these folks because they're sick. Okay. No person-to-person transmission, treatment supportive. Yellow rain, T2 mycotoxins. This is the only toxin that will penetrate through skin. Okay. It can be inhaled, it can be ingested. The result is just like a vesicant. Same result. Okay. Burning pain, redness, blisters, tissue necrosis. Same thing happens if you inhale it. Same thing happens if you ingest it. Okay. So bad disease. No treatment. Supportive care only. Decon is helpful, but not a good thing to get exposed to. Okay. This was published by Health and Human Services, the EMS Infectious Disease Playbook. It gives you best practices for infectious diseases. It can be tailored to your individual setting. It's a great reference. Each chapter gives you specific diseases and what you should do to protect yourself from it. Has the dispatch screening algorithm, has the on-scene screening algorithm, and what modifications you might need to make based on this. Okay, it's a very good reference. I'd strongly recommend you consider it. All right, biologics. Do you need to decon sick patients? Yes or no? Hands for yes. There's one. Hands for no. Hands for quit asking us questions. Okay. If you are already sick from a biologic exposure, when did the exposure happen? Days ago. Okay. The shortest incubation period for most of these is about 3 days. Longest is even longer. So, in all likelihood, that patient will probably have changed their clothes and will probably have showered in the interim. Okay. If they are already sick, decon is a waste of time. Don't bother deconning them. On the other hand, if they are an acute exposure to a powder, the post office exposure, a device that's releasing powder, they got it on them, those people need to be deconned. Okay. Now think about the decon for a second. If I got the powder on me, okay, what you want to do, wet the powder down so that when I take my clothes off, it does not re-aerosolize. Wet the powder down. In addition, don't let them take their clothing up over their face, okay? And pull it over their face. Because if they've got stuff on here and they do this, what are they going to do? They're going to inhale the stuff, okay? So, an acute exposure to powder, cut the clothing off. Do not let them take it up over their head, okay? And then wash them down. Gross contamination, possible biologic, evacuate the area, wet their clothing, remove the clothing by cutting it, save the clothing, put it in a sealed bag. Somebody's going to want to evaluate it later on. Have them shower with soap and water, okay? So, biologics, look at the clinical picture. If it involves their lungs, it's probably anthrax, plague, maybe tularemia. If it involves the neurologic system, they're weak, they're altered, botulism or encephalitis. If it involves the GI tract, it involves things like Salmonella, Shigella, E. coli. We didn't talk about it in this talk, but you're familiar with a lot of these because they happen all the time. Okay. If it involves the skin, you got a rash, or you have a necrotic lesion, you got to think smallpox, anthrax, and then some of these other diseases, and VHF, the viral hemorrhagic fevers, okay? Questions? Okay, do you need another break or shall I continue on? I got another